And welcome back to your Puppy Blueprint, where you can stop guessing, wondering, and Googling how to have a well-behaved puppy and discover how to turn the chaos to calm. I'm your host, Kelly Fahey, and I'm joined by Dr. Maria Bonavita. I want to tell you a little bit about Maria before we get started so you know who she is. Dr. B, as they call her in her practice, is a veterinarian in Durham, North Carolina, proud dog mom of Mia and Wayne, and creator of Doggy Doctors. Got to make sure you spell that one right. She graduated from the University of Florida and moved to North Carolina shortly after and has enjoyed practicing as a veterinarian since. She created Doggy Doctors to help parents, pet parents like you guys, become informed about their animals so they can make informed decisions about their care. Today, Dr. B and I are going to be talking about preventative care, pet insurance, over-the-counter meds, and puppies. Oh my, a whole potpourri of stuff about puppies. Welcome, Dr. B. Thanks for coming to talk with me today.
Hey, thanks for having me. I'm super excited.
Yeah, I'm really excited to have you here. So puppies, we all want happy and healthy puppies, or dogs, of course.
Right.
When our puppies aren't feeling like themselves, we worry. What
Yeah.
kind of preventative care measures can puppy parents implement to set themselves up for success?
Yeah, that's a great question. And there's actually a ton of stuff. So I know that it can definitely be overwhelming to have a puppy sometimes. So I think that the fact that you're doing this is excellent. I'm really excited to talk about it.
Great.
So the first thing I would say is definitely vaccines. So definitely want to get in and establish with the veterinarian as soon as possible once you get your puppy to make sure that we're on track with all of our important vaccines. For all puppies, there's two vaccines that are core recommended by all veterinarians to have them covered for. One of those is rabies, and that's recommended and required by law. That one we're going to do at 16 weeks. And a month later, we'll have them fully covered for that. The other one is a combination vaccine, including distemper, parvo, parainfluenza, and adenovirus. That one, it kind of just depends on when you see your veterinarian first, when we're going to start that, but usually anywhere from 6 to 8 weeks, and then we'll booster it until they're about 16 weeks. The reason why we do that is because when your puppy first gets milk from their mom, she gives them colostrum, which contains a bunch of really good antibodies that help protect them as they're growing and maturing. We have to booster the vaccine multiple times because if we give the vaccine too early while they still have those antibodies, their body isn't going to produce a large enough response and create a large enough amount of immunity to protect them for an entire year. So we're not exactly sure when those antibodies come down all the way. That's why we give multiple boosters. So that's why your puppy's probably going to get about 3 to 4 vaccines of that certain one. Some of the other vaccines that aren't required or recommended for all puppies, but maybe a good idea for yours based on risk and lifestyle include Bordetella, influenza. Those are both upper respiratory infections. It's a part of, you may have heard of kennel cough in dogs. So if your dog's going to be around a lot of other dogs, boarded, groomed, those are really good ones to be covered for. And a lot of the part of the countries right now, there are big upper respiratory infections going on. So definitely one that is pretty recommended right now. Leptospirosis, that one, it's transmitted in the urine between different dogs, between wildlife, and it actually can be transmitted to humans as well. So if that seems like it's a good risk, or your puppy's going to be at risk for that one, definitely a good one to have them covered for too. And that's something that you're just going to have to talk with your veterinarian to see whether you think that those are important vaccines for them. And then the last one, it's just going to be Lyme vaccine. Lyme is transmitted by ticks. So if you're in an area that has a lot of ticks and in a Lyme infested area, then that might be something to have them covered for as well.
Right.
Moving on to the next big category of prevention, that's going to be your heartworm, flea, tick preventatives. Most common ones I would say that we recommend are monthly preventions, oral tablets that we use that. So for heartworm preventatives, Um, just kind of going through heartworm disease a little bit. Heartworm disease, it's transmitted by mosquitoes, and the name is pretty literal. It's actual worms in the heart. So when a mosquito that's infected bites your dog, the little baby heartworms migrate through the tissues and they end up in the vessel that connects the heart to the lungs, and they mature into real worms in that vessel, and then they produce baby heartworms. You can imagine that having a worm in your heart is not great for blood flow, so definitely much better to go ahead and prevent that. And luckily we do have a lot of products that are really good at doing that. So definitely recommend having your puppy and your dog on heartworm prevention year round. Another great benefit about that is that they all can, or most of them contain a dewormer as well for any kind of intestinal parasites. Fleas and ticks, they usually have a combo product for those as well. So fleas, they can be really itchy, can cause a lot of skin issues in our dogs, and they also can carry tapeworms. So if your dog ingests a flea, they can have tapeworms, which no one really likes the idea of having a tapeworm infested puppy. So definitely better to prevent that as well. And then ticks carry a lot of nasty diseases too. So definitely recommend year-round prevention for those. Even I know there's some areas where it's colder and people don't really do it in the winter. And the thing about the flea life cycle is that it's 3 months long. So if you do end up having a flea infestation, you're going to probably take 3 months to fully get rid of it. So much better to just have them on it year round and have them covered. The next really good thing to make sure that we're doing for our puppies is making sure they're on a puppy specific diet. So want to make sure that on the back of the bag, it says that it's complete and balanced for growth in your puppies, because the nutrients that puppies need to grow and become a full, beautiful dog that they want to be is specific to them. So definitely want to make sure they're on a puppy diet. And I would say a grain inclusive puppy diet as well, just because right now we're still doing studies into it, but there has been a link to a certain heart disease with grain-free diets. So I think it's better off to just avoid them overall. And lastly, something that I'm personally really passionate about is dental care. So I'm sure a lot of other people have been talking about like socialization and exposing our puppies to things. Something that I really love is getting your puppy used to you being in their mouth. So once they become an adult and get all their nice adult teeth in, daily teeth brushing is going to be the best way to keep their teeth nice and clean and make their gums nice and healthy, just like us. So getting your puppy used to it, what I usually recommend is you get the dog specific toothpaste, and they come in ones that are flavored. So there's chicken flavors, beef flavors, cheese flavored, peanut butter, all that good stuff. It sounds a little bit gross to us, but puppies love it.
Yeah, we're used to that minty stuff, but that's not
right.
not for the dogs. They're fine with the chicken and the beef.
Yeah, right. So, and it helps make it a really positive process too. So I usually recommend just putting a little bit on your finger and then just rubbing it on their gums. And then they realize like, oh, this is actually really yummy. And they look forward to it. Every night when I brush my teeth, my Great Dane is waiting at my counter like, okay, it's my turn. So if you make it a positive process, it'll be something that your dogs look forward to doing every night. Hopefully something that you'll remember to do as they go forward. And hopefully it'll at least decrease the amount of professional dental cleanings your dog will need future in life, and definitely reduce the amount of teeth that they may need extracted. So that's definitely a really good way to get your puppy set up for success later in life.
Excellent. And, so much information packed in already about everything. For people who might be asking and questioning about vaccines, is there parts of the country that might need certain vaccines more than others for those ones that are a little bit, not your core vaccine? So for instance, like lepto and whatnot, is there certain areas that you live that you might want to look at these a little bit closer just because of your lifestyle and whatnot?
Yeah, good question. So I would definitely like talk to your veterinarian about it. They're going to know your area the very best to know whether it's really prevalent in your area or if it's something that like we don't really need to worry about so much. Lyme disease is definitely most prominent in like the upper northeast area and kind of the Midwest, but it is trickling down more into the south as well. So it's kind of just a risk sort of thing. If your dog is on monthly prevention for ticks and you don't really go to areas where there's a lot of ticks, that's probably going to be good because the tick preventatives are meant to kill a tick within 24 hours. And it does take, it's been shown to take like that 24 hours for them to transmit disease. So as long as they're on that tick preventative, they should be covered for that. And then like influenza and bordetella, those are going to be just kind of a lifestyle risk sort of thing.
Mhm.
I would say, I mean, in my area, I do, if they're going to be around any other dogs, I personally recommend Lepto for them.
Yeah, yeah. And I know where we live, we're out in the country, and so we do have a lot of wildlife, and
Right.
there's can be standing water because of the
Yep.
the different wooded areas and everything. So we always make sure that we get that just as a preventative, because our dogs like to go into the water.
Yeah. It's hard to completely eliminate them from drinking gross water as much
Yeah,
as we
and
want them
you
to. So,
and I bring water with me when we're out, but when you're out and you're walking, sometimes they just walk by and
mhm.
they take a few slurps as they go, and you're like,
Yep.
oh,
Yeah.
yeah,
They like the extra flavored water,
yeah, yes,
the clean stuff.
it's season. Um, and you brought up heartworm, and some countries are definitely like the South. It seems like a lot of dogs that go into rescue or shelters down there, they just come in with heartworm just because of the area that they live in. It just seems like it's a lot more prevalent down there. Like it
Yeah.
seems like to be, unfortunately, more of like the norm. And of course, we know dogs going into rescue and shelters, they're not always having the best care, but like a simple treatment could take care of that. And if nobody's ever seen what a heartworm looks like, or heartworms in a heart, give it a Google. It's
Yeah.
really, it's awful.
Yeah. It'll take you back for sure. And,
Yeah.
it's preventatives, they can be like a little bit pricey, but I promise you that heartworm treatment is much, much more pricey. And there's a million side effects from the treatment. It's a lot more risky. You
Yeah.
have to have them rested for like months on end,
Yes.
or there's even more risk of like sudden death with it. So it's not something to mess around with and
Yeah.
really just please prevent it.
Yeah, I joke that like I don't scare too easy, but heartworm is a little scary because
Yeah.
the treatment is hard on the dogs,
Yep.
for everything. And it, it's no joke. They do need to be on rest, because if they are running around, if they have heartworms, there is a chance that that could dislodge, and they could die. And so
Yep.
the stress of that is enough to worry me, just
Yeah.
to not want that to happen, and everything. And so, those are great tips, because as you mentioned, sometimes it seems like it might not be cheap to do these things, but the long-term impact tends to be a lot more expensive if we're not, being proactive, and we have to be reactive to all of that.
Yep.
And I love what you said about introducing the brushing teeth gradually in a positive way, and just by starting off with a
Mhm.
little bit on your finger, yum, right? The dog is getting used to, licking that off your finger, and you can kind of massage in around a little bit. Like, you don't have to get in there right away, and
Right.
just let them
Exactly.
kind of acclimate to it. And then as they kind of get a little bit used to that, you can graduate to a toothbrush. Do the same thing where you put
Exactly.
it on the toothbrush. And what puppy is not going to want to put that in their mouth? Come on, they put everything in
Mhm.
their mouth. And
Exactly.
you can kind of start playing a little game where you do it a little bit easy, even if you're not
Yep.
getting it 100%. You're just acclimating them slowly, making it
Mhm.
a fun time. And then before you know it, when you build that up a little bit, you'll have a dog like your dog Wayne, who comes over
Yep.
for their toothbrushing at your time and
Yep.
everything. Excellent. So much great information there. Lots of information. I know everybody's going to
Yeah.
want to kind of listen back a little bit and kind of catch some more of that again. So we of course worry about when we have our puppies, like the long-term challenges. As they get older, it's hard to watch our dogs age and everything. And then sometimes there's unexpected illnesses or surgery. And sometimes we hear about other people's dogs who need, different surgeries because of, their hips or whatnot. With that comes the big question of whether they should put money aside in an account for emergencies for the dogs, or if they should get pet insurance. Do you recommend pet insurance?
Yes, I definitely do. And that question, it's a good one. And it's certainly up to everyone. I think that pet insurance is at least something that you should look into while your puppy is a puppy. There's a couple reasons for that. One, when they're a puppy, they're going to have the least amount or hopefully no pre-existing diseases at that point. Because the one thing that no pet insurance company covers is pre-existing diseases. The thing that pet insurance mostly is for is unexpected illnesses. So like you were talking about, they need an unexpected surgery if they ate something they weren't supposed to, or if they have something wrong with their hips, or they get a fracture or something like that. It's going to cover those things. Most companies, most plans don't cover routine things like vaccines, dentals, and that good stuff, unless it is like more of a treatment thing for the dental. But you can get plans and add in on that, like a wellness plan to it. But yeah, you just never know when your pet is going to have an emergency. There's a number out there that 1 in 3 pets require emergency care per year. So, I mean, no one thinks that an emergency is going to happen to their dog until it does, and you're stuck with couple $1,000 bill that it's hard to cover. Another good thing to note, though, with pet insurance, I think there's only one pet insurance company, Trupanion, is one that actually pays while you're at the vet. Most of the other ones are based on reimbursement. So in an ideal world, you would actually have pet insurance and a pet emergency fund, because a lot of hospitals do require you to leave a deposit before starting any care or doing the surgery or anything like that. So you unfortunately do kind of have to have that money to put down up front, and then you'll get all of that or some of it back based on the company that you go for. So yeah, definitely really good to look into pet insurance while your pet is a puppy. And it can be really overwhelming to be looking into pet insurance companies. There's a lot out there. There's a lot of different like fine print that you need to look through.
Right.
There's a couple of tools that I think are pretty helpful. One of them is Policy Advisor. You just put in all of your pet's information into there, and then they have a list of some of the pet insurance companies, and they give recommendations based on your pet's age, breed, all that good stuff. Not all of the pet insurance companies are on there, though, so I think it's good to still use kind of some of the other websites as well. Embrace Pet Insurance has a comparison tool with a lot of the other pet insurance companies on there. Obviously, that comparison tool is going to be a bit biased because it's on their website,
Right.
but it does have a lot of good information on there too. Some of the important things to note when looking for a pet insurance company. The first one is, what's your deductible? So that's going to be what you're going to have to pay for upfront. When something happens, you do have to pay a certain amount before that anything gets covered. Something that I actually recently learned is that some companies do a deductible per incident. So if they eat a sock this one time, you get that deductible. If they get sick with pancreatitis, let's say, another time, you have to pay a whole nother deductible. And then some other companies will do a deductible per year, which I think is what it usually is like for a human insurance. That's
Right.
something to read the fine print there so you know about that. Another thing that is kind of surprising sometimes are orthopedic wait times or waiting periods. So a lot of pet insurance companies have about like a 6-month waiting period for orthopedic diseases. So what that means is, like, if your pet has hip dysplasia or they tear their CCL or ACL, like within 6 months after you get that pet insurance, it's not going to be covered. So that's another good incentive to get them covered as soon as possible, especially if they're a breed that is prone to having orthopedic stuff going on. Um, and another thing that sometimes is in the fine print too is that with that orthopedic waiting period, they require an exam right when you get the pet insurance to have a veterinarian say they don't have any orthopedic disease right now. So just make sure you once you settle on a pet insurance company, fully read the policy and make sure you're getting everything you can out of that.
Yeah.
And then other things in the actual policy to look out for, see what your annual limit is. A lot of them you can change. That's going to be how much they will cover within a certain year. A lot of them have different percentages that they'll cover once you get to that deductible. So a lot of them are really personalized. You can personalize them to what will work best for you. But definitely a really good thing to look into.
Excellent. Yeah, I jotted down a couple of things because you have so much great information. I didn't want to forget some of the things that you were saying. So you talked about pet policy, and that's PAW, right? PAW, and
Yeah,
not
policy advisor.
policy, not policy, right? I just wanted to
Yep,
make
yep.
sure for everybody listening that we got that right. And I really do love your idea of also an emergency fund in addition to pet insurance, because I know I've seen it a lot in just like local Facebook groups where I live. There's always, if it's going to happen, it always seems to happen after your regular vet hours and
Yep.
you're trying to find the emergency vet, and then you go and you're already upset because of whatever has happened with your dog, whatever, because
Yeah,
an emergency has brought you there. You're already in distress. And then
right.
you get that estimate, the low and the high, and you have to leave that deposit. And there's a lot of people who struggle with that because,
Yeah,
especially given our current economy, sometimes,
right.
some other things are kind of slipping by the wayside because we've got to pay for some other things. If you can tuck some stuff away, I think that's a really great tip, because I've seen so many people trying to set up GoFundMe's and whatnot, and their dog can't get the help they need unless they put that deposit down. And it's not because veterinarians are uncaring or unfeeling. It's just that they can't afford to foot the bill for everybody's dogs and pets who come in, who somebody might not be able to pay. They have to keep their doors open as well. And
Yeah,
having that emergency fund, even if you're going to get reimbursed, is a good idea. So I really love that, because I think a lot of people think one or the other, but that combo
yeah.
is a really good idea. I know I've been there. I had a puppy who had a lot of health issues from the time he was a puppy, and
No.
yeah, we called him our frequent flyer at the vet,
Oh,
and he was he was our project. and
yeah, yeah, yeah.
and he did not have pet insurance, and I will tell you, there was lots and lots of bills his entire 12 years of his life. uh,
Yeah,
I would do it all again for him. I loved him dearly, but it would also
sure.
be nice to have a little bit of ease with those
Yep,
expenses. So
yep, absolutely.
yeah, and we definitely don't want to get, caught and feel in a situation where we feel helpless, because when you know, if you're watching this, it's because you love your pet and your pet is family, and you don't want anything
Yeah.
to happen to them. And when they are not well, you stress over that and
Hmm.
everything. And so, yeah, trying to find the right pet insurance company can seem like a daunting task. And it is really hard to compare all the different policies out there. It's almost like you have to sit down one weekend and kind of do a little bit of a project. So hopefully,
Yeah,
policy will help with that and narrow it down, like some of the research for people, because
yeah,
yeah, that in itself is also can be a project.
yeah, for sure.
Oh goodness. So of course, the first thing anyone should do if their puppy isn't feeling well, or even their dog, is, or if they're not acting like themselves, is to see their veterinarian. But is there anything that can be done, at home for certain symptoms while waiting for a veterinary appointment?
Hi, Betty. Yeah, so like you said, if you're concerned about your puppy at any point, first thing to do is contact your vet. And that's another really good thing about when you get your puppy, try and get established with a veterinarian as soon as possible so that if something does happen, you're at least an established client. And hopefully they can get you in a little bit sooner rather than later. Um, So there are, I mean, a couple things while you're waiting for an appointment. So, for example, if your puppy is shaking their head a lot and scratching at their ears, maybe they have an ear infection going on, and that is something that you probably will have to see your veterinarian for. But something you can do in the meantime is try and give their ears a good flush out because maybe it's something got stuck down in there, and that's the reason why it's irritating them. So it's good to have like a nice ear flush at home just so you can do that if needed. A couple ones that I like are Epiotic Advance and EpiClean. They're just nice, gentle ear cleaners that you can use in most situations. So the best way to give your dog's ears a good flush out is you'll just want to pretty much fill the entire ear canal up with that solution if they'll allow you to. Massage the base of the ear for about 60 seconds. What that's going to do is really break up the debris that's down in there and hopefully loosen anything that might be stuck down in there. And then use a clean cotton swab and really dig anything out that's in there. If at the beginning they don't love you just like putting that solution right down into your ear, you can actually just soak a cotton swab and put it in the ear and swish it around. The ear canal is not that deep, so don't worry too much. You're not going to lose it into their brain if you if you just put that in there. I know some people worry about that, but you won't lose it, I promise. But yeah, if it is really infected and really angry, you're definitely still going to have to go into your veterinarian and probably get some medications for that.
Yeah.
And then another thing, like if your puppy gets just like a little bit of a scratch on their arm or something, if it's really small, it'll probably heal on its own. But in the meantime, if you want your veterinarian to look at it, obviously they're always going to be happy to do that. You can put just some Neosporin on it. That's fine. Just make sure it doesn't have a steroid in it. Just you want it to have the antibacterial there. Just because the steroid can slow the wound healing if it does have that. Something that's pretty common in puppies is diarrhea. Unfortunately, in puppies, the most common cause of diarrhea are intestinal parasites. So that's going to be something that you are going to need something from your veterinarian for likely. If they can't get you in right away, you can ask if maybe you can drop off a fecal sample and they can take a look at that for you and see if there are any kind of intestinal parasites and potentially provide you a dewormer or treatment for that, just kind of at home. But something like the over-the-counter diarrheal products probably aren't going to be super successful just because it is usually infectious for puppies.
Right.
But yeah, those are some of the kind of the common things that happen in puppies that you can do at home.
Yeah, and that ear wash is a great idea. I know our puppy, of course, it's the weekend, and he was like, they look at you and kind of hang their head a little bit, and you kind of just know if you ever had a dog that's had an ear infection, it kind
Yeah.
of holding the head a little bit, and I was like, oh, buddy. I smelled it, didn't smell anything. And he kind of like would flap his head a little bit. It wasn't bad, but I did flush it out and then it didn't bother him again. So I do think there might
Yeah.
have been a little something that just caught loose a little bit. And so we were able to do that. And then we actually ended up not having to go to the vet, which
Yeah.
was a good thing and everything. So sometimes it might be something as simple as that. And you can maybe give your pet some relief and see.
Yeah. And sometimes that will just fix the problem and you don't have to worry about it anymore.
Yeah.
So that's awesome.
Yeah. And so the ear wash that you were talking about, is that something that somebody can buy over the counter, or do they have to get something like that from their veterinarian?
So the EpiClean is something that we do carry. The Epiotic Advance, I believe you should be able to get that online.
Okay. Okay. Yeah. And so some of these things are great to have on hand if you do need them, because when you need them, you need
Yeah.
them, and then you don't
Yep.
have to go. And especially if you've got to get something online, you can't just go run to your local store and pick it up. It makes it a little bit harder because you've got to wait for the few days for it to ship and everything. So
Yeah.
yeah.
Yep.
Excellent.
I think the EpiClean may be at like PetSmart as well. But yeah, if like the first time you go into your vet, just maybe ask them for their recommendations and see if they have a good ear cleaner that you can get from them. I think that's probably your best bet.
Yeah, and establishing a good relationship with your like a veterinarian when you bring your puppy home to start is like a really good thing for obviously many reasons.
Yeah.
But you know, getting in and getting that partnership with your vet is great too, because we've had a lot of puppies grace our door. So when
Mhm.
you've got that good relationship with your veterinarian, and they know your dog or your puppy, when something comes up, and this has happened to us, where puppy's got a little bit of diarrhea and then it's seemingly getting worse, and you can, because they know your puppy, you've been in there a bunch of times, you can just drop off that fecal sample, and it might be as simple as getting some meds, and you don't even have to go in because they've
Yeah.
already got their medical history. And vets are busy right now. Everybody adopted a dog during the pandemic,
Yeah.
and sometimes it's hard to get in, and they're going to take obviously the more pressing cases before some other cases, because the emergencies are going to come in first. And
Mhm.
so being able to do some things like that can really help you out on your end and alleviate your stress. And you might not have to go in for that visit if it's something that's simple. That's
Yeah,
fantastic.
definitely.
Excellent. And so I know I've seen, and you've probably seen it, more than I have, well-meaning people who want to help their dogs. And if it's after hours during the week or on weekends, or just because they think, my dog's not feeling well, they're going to try to help their dog at home. And they often reach for something in that medicine cabinet to try to provide relief in the meantime. And there are certain over-the-counter meds that might be safe for humans, but aren't safe for puppies or dogs. And, I know for one, I've seen a lot of people just trying to give their dog like Tylenol, which can be very bad for.
Yeah.
So, can you share some of the over-the-counter meds that are dangerous for dogs that people should not reach for, and some things that might be okay to use if you need to?
Yeah, sure. And yeah, I definitely do see that a lot, and it's never in a malicious way. People really just want to make their pet feel better. And like you said, like it's after hours and they can't contact their veterinarian, or maybe they're thinking that their vet's busy and hopefully it's just a quick fix, but a lot of times it does end up causing more harm than good,
Yeah.
especially when it's going down the pain management route like you're talking about. So things that I definitely wouldn't recommend giving to your pet are some of those over-the-counter pain meds like Advil, Aleve, Tylenol, all that kind of like non-steroidal anti-inflammatories, aspirin. Um, it's some veterinarians use it in certain situations for certain things, but we have much more safe non-steroidal pain inflammatory medications for your pet. So much better to just go ahead and get that from your veterinarian. It can cause, if you give those medications, it can cause some really severe like gastrointestinal ulcers and bleeding, diarrhea, vomiting. It can also cause kidney damage, liver damage, just because the doses for pets and like dogs and cats are much different from people, and the way that they work are a little bit different, the pet versions versus the human versions. So I would overall just recommend avoiding those. Um, and then definitely prescription drugs are something that you want to avoid giving to your pet as well. Things that can be pretty dangerous for them include like birth control, just because estrogen in large amounts for pets can be pretty damaging. Antidepressants, sleep medications, ADHD medications. Definitely don't want to give those to your pets. And a lot of times it's an accidental thing when they do end up getting those ones. But yeah, definitely contact your vet immediately if you see that your pet has gotten into any of those kinds of things. Some of the things that we do use that are over the counter for pets, some of them include like antihistamines like Benadryl. If your pet is having any kind of reaction, like their face starts to swell up, gets really red, they're getting like really itchy, definitely contact your veterinarian right away, because you will want to see them. They may recommend going ahead and giving them an antihistamine like Benadryl if you live far away or something like that. There is a specific dose for that though, so I would recommend still contacting your veterinarian before you go ahead and give that. Some people, if their pet has had a vaccine reaction in the past, We recommend giving them a antihistamine before coming in to do vaccines in the future, just to be safe. But again, like your veterinarian's going to give you a specific dose for that. I mentioned Neosporin before. That's something that I do tell people that they can go ahead and put on like really minor wounds that happen on their pets, just because it's an antibacterial and doesn't really cause any harm there. Something that people probably have heard of if they do, and if your pet does ingest something that they're not supposed to, is using hydrogen peroxide to make them throw up. That is something that it's sometimes effective, but it can cause more damage than good in some cases. Some things that they eat, like if they're corrosives like bleach or something, you don't want them to throw that back up just because it's going to cause more damage coming back up. There's much safer ways to make your pet throw up something. So if your pet ingests something that, again, they're not supposed to, contact your veterinarian right away. If you live in like a really remote area and you're like 2 hours away from a vet clinic, they still may recommend you do hydrogen peroxide based on what your pet ate. But better to talk it over with someone before going ahead and doing that.
Yeah, because, again, it's all well-meaning. And when we hear things that we can use hydrogen peroxide, sometimes people will reach for that first without realizing that by having their dog throw up whatever it is that they ate, it can cause more harm than good. And so
Yeah.
definitely something that can be done, but you really want to make sure that you know what your dog ate first. So this way you don't cause further harm or damage. And again, it's all coming from a very well-meaning place.
Absolutely.
And then of course, when we do, we feel bad when we do something, so we're trying to help our pet. And then we realize
Yeah.
we didn't help them. And then we feel bad for that. So it ends up being a double-edged sword with everything.
Right.
And you had
Yep.
mentioned earlier about Neosporin, and there is a couple of different kinds, and there is one that you recommend over the other.
Just the one that has like an antibacterial in it. So make sure it doesn't have any kind of steroid, because that can cause decreased wound healing and it can take longer for that to resolve.
So like regular Neosporin. I can't remember what the other one is off the top of my head, but it's like, like Neosporin plus. I mean, that's not it, but
Yeah.
it sounds like it would be better because it's Neosporin with, and
Right. Yeah. Just
yeah.
we don't want with anything.
Yeah, yeah. And
Yep.
if you look at them, you're like, well, why wouldn't I use this one? Because this is going to be better for like pain, right? But because of what's in it, and if you read the back, you'll see that there is the ingredients are similar, but there's that big difference that can cause the problem for your dog. Excellent. Well, this was really helpful. And before Dr. B leaves us, she actually has something that she wants to share with you guys, and it revolves around everything that we talked about today, which was a lot of information, a lot of great information.
Yeah, so I actually have a website. It's called doggydoctors.org. And I put blog posts on there, and I actually have one about prepping your puppy for everything veterinary involved. And it actually goes over a lot of the stuff that we talked about today. So vaccines, heartworm, flea, tick prevention, nutrition, dental care, pet insurance. I have links to some of the things I talked about as well in there, and it has a couple additional things on there too. So if you missed anything that we talked about, go check that out. It probably has the information that you're looking for.
Yeah, perfect, because there was a lot of great stuff in here, and it'll be great if they can go kind of have that all in one spot and look up some of that stuff, including those links. So thank you so much for that.
Yeah.
All of this has been really informative for everybody. Before we go, do you have any last minute advice or thoughts for our audience?
Yeah, I would just say something that I like to say is a few minutes of preventative care per day can limit the really big expenses along the way. So just try and do the preventative care as much as you possibly can. I know things happen, and if things do happen, your pet eats something, your veterinarian is here to help you. We're not judging you for anything that happens, so we're always here to help. And then one other thing that I'd just like to say is please be kind to all your veterinary staff. They're always here to help you, especially veterinary receptionists and techs and assistants. They're putting in the hard work, so please be kind to them.
Yeah, I love our vet. He's fantastic. I can't say enough great things about him. I appreciate him. He's been a great partner for us, and the vet staff as well, and the vet techs. I don't think they get enough credit often. They've got
Yeah,
they're not just the ones kind of helping hold the dog during the veterinary visits when they get their shot.
yeah,
They're doing a lot of stuff behind the scenes for us and everything. So yeah, definitely be kind to your vet and your vet staff and everything. This is a tough time for veterinarians when the pandemic hit, and we're hearing about vet shortages. We're hearing about staffing shortages in vet clinics, and it can be frustrating when you try to get an appointment because you need to get in and you might not be able to get in right away, whether it's your regular vet or an emergency vet and everything.
yeah.
So yeah, be patient and kind to them. I don't know what I'd do without my vet and their team. They are part of my team and keeping my dogs well,
Oh,
and I appreciate them very well.
good.
Yeah, drop off some goodies to your vet's office if you love that. We always drop off.
we,
We
we
drop off.
definitely do love it.
Yeah, we drop off some goodies. I really appreciate them. Well,
Nice.
I really want to thank Dr. Bonavita for joining us today and talking about all of this from a veterinarian's perspective. I really appreciate it. And I want to thank all the puppy parents who tuned in, who have their puppies' well-being in mind. Thank you, everyone. Have a great day.
Bye. Thank you.
Bye-bye.